Welcome, everyone. Thank you for joining us today. I'm Theresa, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Due to the scope of the current testing, we will no longer be providing the total people tested or the number of tests pending. First of all, I'd like to thank our municipal partners in the town of Essex for another successful drive-through testing day. More than 500 people were tested yesterday. A big thank you to our OPP partners, Windsor-Essex Community Health Center, Essex Windsor EMS, and all of our health unit staff for their great work. Drive-through random COVID-19 testing will continue today in Kingsville at the Kingsville Recreational Sports Field at 1742 Jasperson Lane. Please access this site from Kratz Side Road. Testing will be done from 10 till 5 p.m. today. Any resident of Windsor-Essex County 12 years of age or older can be tested. People will need to provide their health card number, first and last name, date of birth, and address. Please check the Ministry of Health's online portal or the link on our website to access your test results. I will now share the most current case counts. There are 92,410 confirmed cases of COVID-19 in Canada and 28,709 cases in Ontario. Chatham-Kent has 146 cases, and Sarnia-Lambton has reported 266 cases. Michigan now has 57,731 cases, with 11,068 cases being in Detroit. Today, we are reporting 982 cases of COVID-19 in our community, an increase of 5 cases from yesterday. 3 of the 5 new cases are healthcare workers. 566 cases are now resolved. 20 people remain in the hospital. 19% of our overall cases are between the ages of 20 and 29 years, 18% are between the ages of 30 and 39 years, and 16% of the cases are 80 years or older. 49% are male and 50% are female, with 1% unknown at this time. Our community has lost a total of 66 people to COVID. 49 of these deaths have occurred among residents in long-term care and retirement homes. Our health unit is currently working with 2 long-term care and retirement homes that are experiencing a COVID-19 outbreak. Testing is available for symptomatic people, those who have at least one symptom of COVID-19, even mild symptoms, and testing is also available for asymptomatic people based on their level of risk, including people who are concerned that they have been exposed to COVID-19, people who are contacts of a confirmed case, or who may have been exposed to a confirmed or suspect case of COVID-19, and people who are at risk of exposure to COVID-19 through their employment. This includes essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or who is concerned that they've been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wichu.org for the most current information and case counts. I will now turn it over to our Medical Officer of Health, Dr. Wajid Ahmed, for further updates regarding COVID-19.
Good morning, and thank you for joining us again. Yesterday, the provincial government announced the official extension of the emergency orders to June 30th, including continuing the limit on large public gatherings, social gatherings of more than 5 people, and closures of bars and restaurants with the exception of takeout and delivery. Since the launch of Local Food Act in 2013, the first week of June has been designated as Local Food Week. To celebrate the local food farmer produces across Ontario, Although the world has experienced many changes over the past few months, local food producers are essential to keeping food on the table. Many have made business model changes to allow for direct farm purchasing through farm stands, markets, and produce box delivery services to fill shortages that many large chain stores were facing. For many, staying home has provided the opportunity to reconnect with food and appreciate how food moved from farm to table. As well, this added time to home has increased the importance of food skills and cooking from home or cultivating a home garden, learning about the different ways to access food. How we can shop local is a key aspect of supporting local businesses and developing food skills. Buying local food not only helps local farmers and food vendors, it supports the local economy and encourages a sense of community. There are a variety of ways to access local food in Windsor-Essex, including visiting farmers market or farm stands while practicing physical distancing and proper hand hygiene. Look for Foodland Ontario symbol on food labels at the grocery stores or while selecting groceries online. Sign up for a local food box delivery service. Start your own vegetable and herb garden at home. Gardens can be as small as one small pot in the window or a full ingrown garden in the backyard. Eating well is a key part of staying healthy. This includes a diet packed full of fresh fruits and vegetables. This recent shift to home provides an opportunity to discover and support local food. Maintaining a diet of healthy food is not only important for your physical health, it also is necessary for your mental health. To find out more information about accessing food and safe shopping, visit www.wechu.org/CV/food. Thank you.
We'll now take questions from the media. We'll start with CTV.
Why the push for food today? Just curious.
So the first week of June is designated as local food week. So in order to celebrate that, we just want to make sure that we are encouraging healthy eating, which is part of our public health messaging. We want people to eat healthy. Based on our data, we know that residents of Windsor-Essex do not eat the recommended fruits and vegetables as per the public health guidelines. So we want to take this opportunity to reinforce that message that despite these difficult times, it is important that we do not ignore the importance of healthy eating, and especially ensuring that you're eating all the fruits and vegetables as per recommendation to maintain a good, healthy physical and mental health.
Obviously, they should be practicing social distancing because I've been out in Canada the last few days, and I've noticed more people shopping the stands and whatnot. So, is there some kind of advice that you would give, the patrons and stand owners?
Absolutely, and I think they all have to still meet the requirements under the Emergency Management and Civil Protection Act and the guidance on the outdoor market. So there are set guidance, set standards that they need to maintain and they need to follow from a food vendor perspective, in ensuring the safety of the food, the safety of themselves, and providing enough opportunity to avoid any gathering of people, which could potentially allow any transmission of the disease. And for people who are attending, obviously, we recommend that you always maintain the 2 meters physical distancing from each other, and also with the food vendor. And if that physical distancing cannot be made, which we can understand in these type of setting, depending on how many people you may come in contact with, it would be recommended that you wear a mask, a cloth mask, while if you cannot maintain those physical distancing. And I think that's the important part as we continue to look into opening more of these businesses and get out more in your community. It is important that we take this as an opportunity while still practicing the public health guidelines to ensure that we are not getting into a position where we are having more transmission. because when more people are congregating, more people are meeting, there is this possibility of one infected person can potentially infect other people. So following the guidelines that if you are sick, please stay home, and while you're out there, please maintain your physical distancing, wash your hands frequently, and wear a cloth mask if physical distancing cannot be maintained.
Okay, just, we're really happy with the testing. You had 500 or over 500 yesterday, over 1,500, over the weekend in Windsor. So have you gotten those tests back? Have you been able to analyze the data from the weekend?
Not at this point. We are getting all of those results back. We will get the results back, and when we get all the results back, we'll have to do an analysis on that. Obviously, the priority would be to reach out the positive if there is any positive, or if there are a number of people who come back positive. So our first goal would be to reach out all those positive to ensure that they are aware and appropriate measures are in place to prevent further transmission of this disease. And we will then look at the data to analyze it in many different ways to find out some of the answers that we are trying to look for. There is specific questions that we want to answer with these drive-through testing, and we will be focusing on that. And first and foremost is to avoid some kind of a selection bias when people who really want to go and get tested, and to get to the place where they usually live, or at least in a place that is near to them, to allow them to an opportunity to come and and do the drive-through testing. It opens up more options for people who, for whatever reason, don't want to go to their healthcare provider or to the assessment center, and make it accessible to them. Having a local data for that specific community will help us better understand and get a better representative sample from this specific community to say what's the extent of the spread in this disease. Because right now, if you're only looking at the positive from an epidemiological perspective, so you're only getting the new cases. You don't know what the other people who were not tested or who were tested and then become negative. So in order to truly calculate a percentage of population to say, hey, in Windsor, let's say 1% of the people are infected, let's say this time, I'm just throwing that number, but what is the evidence that how many we have tested that came back negative, to put those things into perspective, to say, yep, this many positive, and then you have this many negative, and based on that, can we draw some conclusion to say that, yeah, maybe based on that, extrapolating from that data, what that prevalence look like. So basically, it is with a very specific purpose, and on top of that, obviously, to find new cases, especially people who are asymptomatic. So we will be looking to answer those questions, and all those detailed analysis we will be presenting when we have all the data.
Open by Friday?
I'm not sure because of the way these test results are received, because even up until Friday, our drive-through testing will be ongoing. So even on Friday, we have tests going. So maybe I'm anticipating that if we get all the lab results back, hopefully next Friday, just focus on that specific piece, the analysis piece. But we'll continue to report the positive cases as our daily counts that we do.
Any questions from AM 800?
Yes, the 3 healthcare workers that tested positive, is that long-term care, hospital? Do you know where?
Not at this point. I think we are still waiting for some of the details on each of these cases. But all we can say, they are all healthcare workers.
Are you pleased with the outcome so far of the random tests? 1,700 over the weekend, 500 yesterday. Are you pleased with the response from the community?
I am pleased with the response in the community, but it also identifies the need that what the community is looking for, and we are going in with a very specific research question and looking at the interest in the community. It is obviously it's helping us understand some of the challenges, and I'm sure that the appropriate agency will continue to work with to find the solutions for these type of testing. From a public health perspective, this is a very specific reason that we are doing testing, and we'll continue to provide that information, continue to connect with the community from a public health perspective. We'll continue to meet the need of the community from a public health perspective.
Okay, thank you.
Any questions from Windsor 8?
Yes. Were any of the new 5 cases today among farm workers?
No, we just reported the ones that 3 are healthcare worker and the rest are community.
And has there been any increased or targeted testing among farm workers recently?
So from a public health perspective, our ongoing work with case and contact management and cluster investigation, that work is ongoing. We continue to do that. In terms of expanding the testing on these congregate setting, there is a plan from the ministry to do that, and there is possibly a non-hospital sector will be stepping in to do some of these testing in collaboration with other health system partners. Public health is focused on the case and contact and cluster investigation, outbreak investigation, and that work is ongoing and will continue to work on that part.
Any questions from the Windsor Star?
Can you give us a sense of if things are improving in the community, even including long-term care and agri-farms?
So when we are looking at the trend of the data, we do look at the number of cases and where these cases are happening, and some of the indicators are obviously the spread of the virus in the community. When we are reporting these numbers, we see some fluctuations. We see today, so we have 5 cases. Yesterday, we had 7 cases, I believe. And then there were some spikes we noticed up to 23 cases in one day. And so when we are looking at these numbers, what we need to focus on is where are these cases happening? Because if you are testing people on all the close contacts and if they are coming back positive, it is kind of expected. That's exactly what happened with many of these agriculture farm workers. When you're going to this bunkhouse, and if one person is infected and was not isolating himself before they get diagnosed or before they received any recommendations from anyone, they potentially infected everyone else. And when you're testing them, everyone will come back positive. So having more positive case in close contacts may not necessarily be a bad thing. It would be just one of those things that now we know, and now we have a much better plan to contain them. So even when you're looking at the number of these cases in these farms, and we reported that there are a number of farms that are involved, a prompt public health action on all of these cases limited the spread of the disease in each of these farms, with the exception of few that we already reported in the media. So if you're looking back at it from a perspective of whether public health action was targeted, appropriate, yes, because it limited and it contained the disease. There are some unfortunate tragedies happen, which is really tragic, unfortunate, and unexpected, and we will be looking to get some answers on that front. From a community perspective, the concern mainly comes in when we don't have any evidence of a direct contact or a transmission among family members or people who live in the same household. That's what we refer to as a community transmission. If our rate of community transmission is high in the community, then I'll say no, things are getting into the worst direction, and we should be sitting back and looking at our measures to maybe put more strict controls in place to reduce the community transmission. Over the last month or so, what we have seen is the community transmission is going down in our community, dropping down roughly to between 20% or 30% of our cases, which is a good sign. We like to still see that number going down significantly. We cannot eliminate the community transmission as long as COVID-19 exists in our community. So summarizing it all, to your answer, yes, we are not getting worse. We are getting in the right direction. There are some spikes on different days that we have seen, which is something worth investigating, which we did, and most of these are linked to confirmed cases, and that may not necessarily be a bad thing. We will be putting all those analysis and pictures to see, we do our 3-day moving average to see how it impacted our epi curve, and we'll make some recommendation on that. But so far, we are moving in the right direction, and we hope that if everyone is following the public health recommendations, we will be in a better spot soon.
Has the province or Public Health Ontario provided any guidelines for declaring an outbreak at an agri-farm aggregate housing setting?
So that recommendations should be coming out soon in terms of what's the threshold for declaring outbreak? What does it mean when you declare an outbreak, which either a reporting requirement or some high-level guidelines in terms of how to how do you work with that industry? Because really, when you're talking about all these agriculture farm workers and their issues, there are at least 4 different aspects of it which I can identify. So one is the case and contact management, which public health is responsible for, and which we were doing right from the beginning, and identifying these cases early, ensuring that they're isolated, ensuring that their contacts are identified, and they're all in isolation to ensure that there's no further spread. The other aspect of these case and contact management is the actual assessment. Many of these farm workers are going to the hospital, going to the assessment center where they are actually seen by a healthcare provider, and based on that assessment, a determination is made in terms of whether they need ongoing support, ongoing follow-up from a healthcare provider, or if they need any hospitalization, or if they need any inpatient, any ICU support. In limited cases, some of these workers ended up in getting hospitalized based on the clinical assessment, and that happened. From a public health perspective, our nurses are calling these individuals every day as per public health guidance document and as per public health work, because our role is more on the public health side, not on one-on-one side of these patients. So that work is ongoing. The second aspect of it is housing, how these people are housed, and who is responsible for all of these. So from a housing perspective, accommodation perspective, we do the inspection of these houses to ensure that they meet the criteria for safe housing for many of these based on the guidelines, and that's what we are doing. The other aspect is who's providing the housing, who's ensuring that it is a better housing with adequate number of bedrooms, adequate number of facilities available. That's the employer's responsibility, and then that is also their house. How an individual maintains their house, keep their house, it's entirely up to all of us. The third aspect that is the workplace, and the workplace is a workplace, just like any workplace. It's a private business. How these workplace meets the requirements to be a workplace, a lot of that falls under the Ministry of Labor. And then you're talking about some of the other aspects, which is the fourth part, is how these farm workers behave out in the community, because when they're out of their workplace, they're part of the community. They are our community members, and everything that all of us are responsible for, or all of us are doing, it is exactly the same for them as well. It's no different than anyone else. So there are all these aspects, and when we are really looking at managing these outbreaks and clusters, we'll have to identify what is the specific thing that we are doing. From a case and contact management, that is already happening. We are doing that. We are expanding the investigation. We are, even if we are not calling it an outbreak, but we are treating it exactly as an outbreak. That's how we are identifying cases. That's how we are isolating them. That's how we are segregating them into appropriate places. So it will be a welcome addition to from a reporting perspective, from the guidance for everyone else to understand perspective. But our public health role and work has always been there and have been able to prevent many of these outbreaks. If public health was not there, you could have many other outbreaks or a large number of cases in these communities. And we'll look forward for specific guidance, a specific expectation from the ministry if this is what is expected of public health, and we'll do it.
So it sounds like the label of an outbreak is more just useful for public knowledge, but the health unit and other agencies are already treating these cases as though it is an outbreak.
Exactly. That's a good way to summarize it, and we've been always doing that, and that's what we do. That's why there are times when we feel that there is a lack of understanding of how much work public health is doing behind the scene, because we're not telling each and every work that we are doing, but I can assure you our dedicated health professionals, our staff are working day and night, 7 days a week, to ensure the safety and well-being of our community, and that will continue to happen as we deal with this pandemic.
Just to clarify, we had 3 healthcare worker cases. Does that mean 2 general community cases?
That is correct, yes.
Questions from CBC?
Yes, good morning. I know there's another 69 resolved cases today, so that's up to 566. In some parts of the country, there have been side effects in people who have recovered from COVID. Is the health unit doing anything to follow up with these resolved cases to see if they have had an effect from having COVID?
So once again, I would like to clarify our public health role, just like you and I or anyone else. If I am sick, I will go to my doctor. I will not go to public health because that's the health issue that I'm dealing with. I have a cough and I have a cold. I'm looking for a doctor. I'm not looking for public health. So yes, public health follows up with them because in the 14 days of isolation and 14 days of follow-up until we declare them as resolved, there could be a concern that they need more support, or if their symptoms require much more closer monitoring, we can facilitate that follow-up with the healthcare provider, or an individual can call 911 or reach out to their healthcare provider. This is same for anyone who is self-isolating, whether we are talking about agriculture farm worker, we're talking about a person who is in their home self-isolation. There are those responsibilities that we all share. Public health is happy to support if someone calls us and say that this is what's happening. What do I do? Should I go to see my healthcare provider? Yes, we will make that recommendation. But many of the things that happens, or the question that you're asking in terms of the resolved cases and after the developing symptoms, we would have no way to to get that information unless that individual contact us. But their best option would be to go to their healthcare provider, get properly assessed, and then if there is any concerns from a public health perspective, yes, we would be interested to know that information. And we have been doing that with many of the healthcare providers when they call us. And one of the example I could give is a community physician called me about seeing a child with the suspect Kawasaki-like syndrome. And then we had a good conversation. We came up with a plan of care that, what can be done, what can we answer, how we can support from a public health perspective to get some of those answers done. Those conversations happen all the time, but from a public health side, there is no way for us to know that information or access that information. And even if someone is experiencing that, their best option is to go and connect with their healthcare provider to get the answers that they're looking for.
Has any adults, I know you talked about the child before, but have there been any adults that have had their physicians speak with you about
Side effects or things that have happened after the fact?
We get some of these calls from the physicians all the time. I cannot speak specific to that, but those conversations happens all the time, and I am here to have this conversation with any of the healthcare provider, any of the physicians on their concerns, even from a screening perspective. If someone is concerned, they want to screen someone, they want to provide some advice in terms of the follow-up, we do that, and that conversation is ongoing. I cannot pinpoint to any specific case in that adult population.
Thank you.
Any questions from Radio Canada?
Yes, please. Thank you. Do you have an estimation of the number of complaints that have you received for the housing of the farmers workers?
You're asking if we have a number of complaints that we received?
An estimation of the number of complaints, yes.
I'll have to get back to you on if you can send us email to our team, and we'll see if we can provide you with that information.
Okay, thank you.
Any questions
From Blackburn?
Yes, hi. I understand that we don't have a total number of tests or total number of pending tests, but since testing has been opened up, are you seeing improvements with the labs? Are you pleased with the number of tests you receive back on a daily basis?
So that would be a difficult difficult thing for me to answer, and that's why we moved away from providing that number, because we don't think that number would be an accurate number. The tests that are happening in the community are happening at by different providers, and there is a new testing strategy that was launched by the ministry with other health sector responsibility to enforce and ensure that all of those testing is being done. Even with the expanded testing at the assessment center, even at the testing that's happening at the hospital for their staff, there could be other staff who are going into the assessment center to get tested. There's some of the essential workers, some of the frontline workers. And there's no way to know the denominator, and by denominator I mean how many people are getting tested every day And if we don't know how many of them are getting tested every day, not all the tests are coming back to us as well. So we don't know how many tests are being done every day. We don't know how many test results are coming back unless they are positive. So that's why it's the only thing we can accurately report on is the number of tests that is coming back positive, because it has a public health implication and it has a case and contact management implication. So we are getting that information and we are on top of it. But there is no way, unless each of the partner that are doing this testing are reporting it back to us in a concise way to tell us that we have conducted X number of tests a day, and we have received X number of results back, and this is what it looks like, and then we are able to report that number. But there is no reporting obligation on them to do that unless it's a positive. So if it's a positive, there is a law that they have to notify public health. Other than that, it's not. So I cannot say if it's improving or if it's not, but what we have heard from the labs, that their capacity has significantly improved. The labs are meeting the target as set out by the ministry, and they are trying to fast track many of these results, especially the ones that has a case and contact management implications to attach to it.
In the past, you've told us that the percentage of tests that come back positive gives you a good indicator of what is happening in the community overall. So how will you have that information moving forward?
That's a good question. We may not be able to report that part, and that was something that we identified, and we are trying to get some of that information back from the lab. But so far, it is difficult for them to even report. But we will try to continue to look for that. The drive-through testing, when we are talking about, that would give us a good indicator out in the community, because again, it's a targeted one, and if we are getting the sample size appropriately, we should be able to draw some kind of a conclusion based on that number and based on the people who are tested. So that's why I think there is some confusion. So people are thinking, how is that different from the assessment center? What are we doing? And is it just for convenience? Is it just for what? This is a very targeted one, and there is a specific question attached to it that we are trying to answer, the spread of the disease in the community, in each of the community. And when we have the data, then we can accurately try to extrapolate using that number with the communities to give us a sense of what is happening in the community. And that will be useful for us to understand, helpful, evidence-based to make recommendations appropriately.
Any further questions from CTV?
No, I'm good, thanks.
AMA 100?
I'm good, thank you.
Windsorite?
No thanks.
Windsor Star?
No, thank you.
CBC?
No, thank you.
Radio Canada?
No, thank you.
Blackburn?
No, thanks.
Thank you, everyone.
Thank you.